process is when a patient calls the office, they would speak to a receptionist. They would explain their symptoms. They would review their insurance with them so they can confirm that the services would be covered for them, and they could schedule them an appointment. The first appointment is with me. I'm a board-certified allergist, and I would sit down with the patient, and we would talk face-to-face. We would discuss the symptoms the patient's been having, the medications they've tried, what their triggers of their allergies are, and after that discussion, we could do some allergy testing, either blood testing or skin testing, to identify what they're allergic to. If they have asthma, we'd check an exhaled nitric oxide to see if they have inflammation in their lungs. We'd check a breathing test right there in the office to see if they have wheezing that the patient doesn't perceive. And I always go in the office and review the PFT with the patient right on site, right that day, so they know, where they stand before they leave the office, so we can make so many adjustments to medications right then on the spot. Then we would prescribe medications for them. We'd have them come back in a week or two. That'd give us a chance to see how they're doing with their medications. If they had any allergy testing, we would talk about what they were allergic to, where they could find it, how they could avoid it. If they had lots of allergies, we would talk about treating their allergies to reduce their dependency on medications. And then the patient, it's a conversation between both of us to decide what's the best treatment plan. Follow-up with a patient is individual. Patients who have asthma that require controller medicines, we typically see them at least every 6 months with breathing tests that are done at each visit so we can assess their lung function. If patients have been less well controlled, we see them more frequently. If patients have more simple problems, nasal congestion or eye symptoms that are seasonal, we may see them each year during the season or prior to the season to adjust their medicine so they're ready for the season when it starts.